Welcome back to TV5 News at 9. It's time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Risty Kalivas. And Doctor, thank you so much for being here today.
Thank you, Blake, and good morning.
Good morning. Yeah, so today we are talking about falls and how to prevent them. But to start, you work in the Covenant Emergency Care Center. Can you just give us a little bit of what your day-to-day looks like?
Day-to-day right now, we're very active seeing patients in the emergency department. I work primarily on the senior care side. At Covenant, we have divided up our patients where we have a pediatric side, a senior care side for patients 65 and over, and try to meet their needs and out of the main emergency department. And then for the most part, we've been seeing lots of patients lately, and our volumes are going back up. And my primary job is to take care of the older patient that comes to the emergency department, and they have more of a unique presentation and unique problems.
All right, yeah, and you mentioned that pediatric space, also this senior space, but can you tell us a little bit of what that dedicated space for seniors looks like for them?
Yeah, it's part of the emergency department that's off the main emergency department. We have 18 beds set aside. The rooms have been painted with special colored paints to help people with their depth perception. We have non-slip floors, low-pressure mattresses. We have large clocks with numbers, calendars, and also on that side of the emergency department, we have available to us hearing aids and glasses. If somebody were to forget them, we have devices to help them hear better and to see better in the event they're brought in under an emergency situation and forgot their glasses or their hearing aids, so we can communicate better.
Nice. It helps them prepare them in a safe environment. I like that. So what tips do you have personally for seniors to keep them out of emergency care?
Well, the best thing is to try to maintain your health. Moderate exercise is reasonable every day. Eating a good balanced diet is important. Making sure you take your medications as scheduled. And if you're having side effects from your medications, contact your doctor at once and talk to him about those side effects, so that perhaps your medication can be changed or the dose would need adjustment so that you don't suffer significant side effects from the medication. And in the line of falling, we want to make sure people's medications aren't causing their blood pressure to fall, making them feel dizzy, and unfortunately leading them to a tragic fall where they may break a bone, a hip, a pelvis, or something along that line.
Now, Doc, do you recommend doing anything at home that seniors can do to prevent falls that aren't related to medication?
Yes, there's a lot of different things that can be done. You can kind of make your house trip-proof, make sure that you don't have any scattered rugs that aren't taped down. You can make sure that in the bathroom you have, if you are having difficulty getting on and off the toilet, then you either have a riser on the toilet or you have grab bars that you can grab. The same in a shower. They do make chairs that can be put in showers that don't have to be built in. And having something like that in a shower with grab bars make you much safer. Also, not to rearrange your furniture or have your family come in and rearrange your furniture once you become used to where everything is. And especially at night, where we see a lot of people tragically fall when they have to get up to use the bathroom in the middle of the night, and they don't have night lights, or they don't use their walker or cane to get to a bathroom and suffer falls. So there's lots of things you can do to make the environment around you better. And even in that light, with making sure things are well lit, making sure that when the weather is bad and it's icy, that you refrain from going outside. And if you absolutely have to, wear the appropriate shoes. Make sure that you have some ice melt around or something to make your sidewalks and your stairs safer. And at all times, in the winter especially, which we've just gone through, make sure that you're not going out on ice. Every time we've had a storm with significant ice, unfortunately, we see a lot of people suffer falls and have significant injuries.
Well, those are good tips to avoid that. So, Doc, is there anything that seniors with caretakers should be watching out for so they don't get injured? What should the caretakers see?
Well, the caretaker should obviously look for any trip hazards. If there's anything spilled on the floor, make sure it gets cleaned up right away. If there are small pets in the house, and even larger dogs, make sure that they don't get underfoot. A lot of times people will trip over their cat or their dog, or if they have a large dog, the dog can bump them and knock them over. If your older family member needs to use some type of aid to walk, make sure they're using it. There's a sense of pride in being able to walk without a walker or a cane. However, people don't realize the danger they're putting themselves in.
Yeah, and I say there's a sense of pride in being safe, so I'll take that over injuring myself at all. Doc, is there anything else that you'd like to add? Maybe you didn't get a chance to say?
Yeah, just to make sure people understand, falls are significant. People over 65, about 28% people fall at least once within a year. That's about 36 million people, and tragically, about 10% or 8 million of those people end up dying as either a direct result of the fall or consequently within a few weeks or months after they suffer a fall like that. So the best things to do is to make sure that, you know, if you feel unsteady on your feet, to use any type of walking aid to protect yourself, keep things well lighted, get rid of trip hazards. Don't rearrange your furniture, especially if you've had it in the same places for years and you're able to navigate well around your house. And use caution when the weather turns bad, whether it's rain or snow or ice, that these can increase your risk of slipping and falling and suffering a significant injury that could end your life.
All right, Doc, this has been a great overview. Thank you so much for being here with us today.
Thank you very much, Blake. You have a good day now.
You as well, absolutely. And if you'd like any additional information about today's topic, just head over to the Hot Links page on WNEM.com.